Right, I'm going to try a little full top to toe spinal warm up for us all to do over the summer. So starting with your feet together, then if you turn your toes out, so you make a V, and then line your heels up so that they're behind your middle toes, so that you've got the base of your big toe, the base of your little toe and your heel bone connecting nicely down into the floor. And you want to feel that sense of energy in that dome of the sole of the foot. So you're feeling energy between the base of the little toe and the heel, the base of the big toe and the heel, and also across from the base of the big toe across to the base of the little toe, so you're not dumping down into the middle of your arches. Once you've got your feet positioned, you're just going to place your hands on your pelvis and you're just going to tip your body forwards so that the weight comes into the base of the big toe and the base of the little toe. And then you're going to tip the weight backwards so you bring the weight into your heel bone and draw your sit bones together to help stabilise. Tip your body forwards to the base of the big toe, base of the little toe, trying to spread wide and evenly into those points. And bringing the weight back into the heel and just tipping backwards slightly, drawing your sit bones together to stabilise. And then come and find the point at which you feel your knees are stacked over your ankles and your hips are stacked over your knees and ankles. And then you can release that position. You want to have your pelvis in its neutral position, which means you'll feel soft at the hip and you will feel that you've got a gentle inward curve, and over time you become familiar with your normal. But you don't want your pelvis jammed under so your hips are pushed, jammed forwards, and you don't want your sit bones stuck so far behind you that your rib cage is pushed in front of your pelvis. So you're finding that position where your pelvis is nice and soft, you've got a nice softness at the front of the hip joints, and the rib cage is stacked over the top of that pelvis. And you're growing tall through the vertebra of the spine, all the way up between the shoulder blades, through that sticky spot at the base of the neck, all the way up through the neck to the base of the skull. And imagine somebody's placed their hand on your head and you're growing tall, sending the energy up through from the feet all the way through into the crown of the head. And everything is light and soft. You're going to breathe in, shrugging the shoulders up to your ears. And then as you breathe out, let those shoulder blades melt down your back, keeping your collarbones wide, so you get nice, soft, well-placed shoulder blades. Breathing in and up, breathing out and down. And once more, breathing in, shoulder blades up, breathing out, melting them down your back with wide collarbones. We're just going to loosen up the neck. So you're going to take a breath, and as you breathe out, you're going to turn and look over your left shoulder, taking a breath, breathing out, turning all the way around to look over your right shoulder. Taking a breath, breathing out, turning all the way back to your left, taking a breath and breathing all the way back round to your right. One more breath and breathing out to come back to the middle, taking a breath there, breathing out as you lift your right ear up and away from your right shoulder, taking a breath. As you breathe out, reach down with your right hand, opening up that space between the shoulder and your ear, lifting up and away with your ear. Now breathe into this part, into this upper lobe of your right lung, stretching the tissues through the side of the neck. And breathe out to come back up. Taking a breath, breathing out, lifting the left ear up and away from the left shoulder. Taking a breath, breathing out, reaching down with that left hand and reaching up with that left ear. Now breathe into this upper lobe of the left lung. And breathing out to come back. And then circling the shoulder blades round. And when you circle the shoulder blades round, kind of keep the rib cage and the neck stable, so the spine is nice and stable. And it's just the shoulder blades you're moving on your rib cage. And then reverse the circle all the way around. We're then going to do a couple of mermaids. So you're going to just drop your knees forwards and you're going to reach with your left hand to the side of your left knee and imagine you've got a zip there. You're going to unzip a zipper all the way up the side of your body, so you're side bending to your right, all the way up to your armpit. And then unfold that arm and reach to the ceiling, keeping your knees slightly bent, and you're looking for a stretch between your hip and up into this armpit. Breathe into this side of the rib cage, and if you've got room, you can take the arm up and then breathe out to come back up. Drop the knees forwards, get hold of the right zip, breathing in as you unzip all the way up to the sky. Taking a breath again, and if you've got space, you're going to take the arm over and back up to come out. Once more each side, drop the knees forwards, breathing in as you zip all the way through to the armpit, reach the arm up, take a breath, breathing out to go over and in to come up. Drop the knees forwards, breathing in as you go all the way up, side bending soft through the side of the body as you open the other side and reach to the sky, taking a breath out as you go over and in to come back up and circling your shoulders. We're now going to do some, we've done the side flexions of the thoracic spine, so we're going to do some rotations with the hands behind the head. So I want you to place your hands behind the head, and I want you just to open your elbows a little bit. And if that starts to feel like you are pushing your head forwards because of muscle imbalances, I want you to really try and grow that crown of the head to the sky, open the front of the chest and soften your shoulder blades down your back, so don't let them come up and round, let them open and drop down. You're going to take a breath now, and as you breathe out you're going to turn to face your left, and you're trying to lead with your breastbone, not by pulling with your arms. So your head is staying back in your hands and you're breathing out to turn. You're going to take a breath there, and then you're going to breathe out and try and get a little bit more movement out of there, and then breathe in to come back. Breathing out, going to your right, taking a breath there and breathing out to squeeze a little bit more movement. Your hips are staying facing forwards, breathing in to come back. Once more each way, taking a breath, breathing out to turn to your left, taking a breath, breathing out to squeeze a little bit more movement out, breathing in to come back, taking a breath, breathing out, taking a breath, breathing out, squeeze a little bit more. Use these muscles in your tummy to pull you round and breathe in to come back. Keeping your hands there. If you are pins and needly, take the hands down and give them a shake and give yourself a moment. If they're okay, take a breath. As you breathe out, imagine somebody's got hold of your right elbow and they're pulling it up to the ceiling. So you're opening that right side of your upper rib cage. Take a breath there, and if you feel comfortable, you can then breathe out and turn the breastbone to the ceiling, and you should get a stretch through this part of your body. Breathe into that stretch, opening the ribs, and then turn to face forwards and come back up. Taking a breath there. Breathing out, imagine somebody's got your left elbow and they're pulling it up to the sky, softening on the right side. Taking a breath there, and if you're okay with that, you're going to breathe out and turn the breastbone up to the ceiling, taking a breath to stretch that side of the rib cage. That stretch is coming down through here, and turn back to face forwards, and then coming back up, and then releasing the hands and circling the shoulders. So we're now just going to do a couple of squats for the hips and pelvis. So again, I'm going to turn sideways so you can see what I'm doing. Your feet are hip width apart. You're feeling the three corners of those feet, each foot connecting down into the floor, the base of the big toe, base of the little toe, heel bone. We're going to bend the knees, but the emphasis of the movement is sending the hips behind you, keeping your back nice and strong, your collarbones wide, your shoulder blades pulling down your back, and reach your hands back. And we're going to push up and push down, bending from the hips. So I want you to use your arms to get some momentum, and I want you to feel like the energy for the movement, the fold and the push back up, is coming from your hips and pelvis, not from your knees. So your knees should just be hinging. Your energy is coming from the pelvis. Just warming the body up. Getting that nice sit back and push up, sit back, push up, sit back, push up. Nice soft shoulders, long neck, open through the front of the chest, but don't let your rib cage disappear forwards of your pelvis. Keep it over the top of your pelvis through the movement. And one more, pushing up. Lovely. And then we're going to do, to open the hips a little bit more, we're going to do a wider squat. So you're taking your feet much wider than hip width, and the feet are turned out to about between 30 and 45 degrees. You're going to imagine your back is staying against a wall, and you're going to slide your back down the imaginary wall, just allowing your hips to open, and you're going to check your feet and make sure your knees haven't collapsed over your big toes, so when you look down you can't see your big toes. You want to open your knees so you can see that inside edge of the foot, and push back up. Pushing down the wall, imagine your back's against the wall, and then pushing your three corners of your feet into the floor to come back up. Dropping down and pushing back up. As you drop down and open, try and soften the hips and knees. As you push back up, try and get the energy, draw the sit bones together. Dropping down, back against the wall. If you find it really hard, as you drop down, I want you to have your back straight. If you find that you're tipping forwards because your hips won't allow you to stay upright, you can place your shoulder blades and pelvis against a wall, have your feet a few inches away, but in that wide position, and try and practice just lowering your back down against the wall, trying to get that freedom and find that range of movement in your hips. If they're tight and stiff, they might not like it to start with, so just go within your tolerance. And then to finish off, before we finish this short video, we're going to do some cat-cow in standing. So it's a bit like the cat stretch on all fours, but we do it in standing. So the first thing to do is bend your knees and roll the spine down until you're touching your knees. Let those knees settle, elbows are straight, and you're going to tuck the tailbone and drop your head, keeping your shoulders wide. Don't let the shoulders come up to your ears. You're going to look between your inner thighs, and you're going to lift your belly up towards the spine and lift your ribs up and pull your breastbone back between your shoulder blades. Take a breath there. As you breathe out, you're going to then lift the tailbone, send that movement all the way through the spine, opening your collarbones, drawing the shoulder blades down your back, lifting your head to look forwards, but I don't want you to shorten your neck. I want you to imagine you're lifting your chin into your throat so that you keep the back of the neck long. Taking a breath there. Breathing out, tucking the tail, dropping the head, keeping the shoulder blades wide, lifting the belly, lifting the ribs, lifting the breastbone away from the thighs, and then lifting the tail, sending that movement through the spine, opening the chest, sending your breastbone to face forwards, shoulder blades down, back of the neck long. But your tummy has not collapsed forwards. You've still got some tone in your tummy in this position. Taking a breath, breathing out, tucking, looking between the thighs, opening the shoulder blades, letting the neck completely go so it's hanging like a pendulum. Belly is lifting. And then one more time, lifting the tail, sending the movement through, widening the chest, looking in front of you, chin into your throat. And then we're going to just release the spine, push through the feet and restack. And that's just giving you a little bit of a quick whip through the spine